Hi, I'm Ken Howard and welcome to the Gay Therapy LA podcast. Today I want to talk about gay men and coronavirus COVID-19, a special kind of coping. And I wanted to provide my regular listeners of the Gay Therapy LA podcast some thoughts as the entire community, our world, faces a pandemic of the coronavirus COVID-19 illness. According to CNN, as of March 10th, 2020, there have been 4,000 deaths worldwide and 113,000 people have been infected. Now, for perspective, according to the Association for Safe International Road Travel, the number of deaths per day by car crashes is 3,287. And according to the United Nations, over 25,000 people die per day of starvation. And I cite these various statistics to give some perspective on the kinds of threats people in our world face every day. And yet if you watch the news on TV or online, or hear it on your car radio, coronavirus is much of what you hear about. University classes all over the country are being canceled all over the U.S. and the world. The entire nation of Italy is in some sort of national quarantine. And major events from the PGA golf tournament to plans for White Party Palm Springs are either affected or questioned, whereas revelers currently at Winter Party Miami, an event largely for gay men, are going on as scheduled, unabated. So what are some ways that gay men can cope with COVID-19 as a threat? In many ways, of course, it would be the same as straight men, women, or anyone in the United States or the world, taking contagion precautions such as frequent hand washing, staying home if you're sick, getting medical care if symptoms appear or persist or worsen, staying informed on what the latest public health recommendations are, and maybe just staying home a bit more to avoid crowded areas. And this might be particularly hard for the generally social gay male community, such as Winter Party, I mentioned earlier. White Party Palm Springs is still going ahead as scheduled for now with thousands of people in one place, but in some cases, like college campuses, they're closed for the remainder of the spring semester or moving classes to an online platform. The challenge, just like with any virus in the news, from AIDS to other STIs to others, is to balance what is a reasonable precaution in service to the public health versus what is an irrational hysteria and anxiety out of proportion to the actual threat. When I do cognitive therapy with clients and I help them with anxiety, that's one of the core issues about managing anxiety, is coming to terms, regulating our own affect of fear and panic in response to a stimulus that is maybe out of proportion to what the stimulus actually is. Or that's like a phobia, having a fear of something that's really out of proportion to the threat that it actually poses to you. Now, coronavirus or COVID-19 has not yet been identified as a global plague that needs to be responded to with a complete cessation of public life. The effects of doing this prematurely would have severe global and social and economic consequences, but we must meet the threat with credible, reasonable, rational, and most of all, evidence-based responses based on science, not a shrill hysteria that has no basis in fact. We need our government leaders to be science-based in guiding the people worldwide, and in the age of climate change denial by Republicans in America and other global, vicious, greedy, and just plain stupid oligarchs across the world, that's not likely to happen. Another tip for gay men, just as for everyone, is using critical thinking. Don't join the latest fad of stockpiling toilet paper and cleaning off the store shelves, or any other idea that's based on colloquial hearsay or rumor that doesn't have some kind of public health organization or science-based government endorsement. Use common sense about nutrition and rest. Telecommute to work when you can. And be good to yourself, since I've tried to be. And if you find yourself triggered by shades of the early AIDS crisis, that's normal for gay men, particularly if you're middle-aged or older. As one gay friend said, comparing COVID-19 to AIDS to a straight friend, welcome to my world. Those of us who have been fighting stigma with facts for decades have all been here before. As the COVID-19 crisis, such as it is, which is subject to some debate compared to other global threats to life and health, unfolds, I am reminded, and dare I say triggered, by shades of the AIDS crisis. The usual bigoted, incompetent, greedy, arrogant Republican leadership in the United States back then, in the 80s, was murderously cavalier about thousands of deaths then, adding up, because AIDS was only seen as only affecting gay men and early on Haitians, as opposed to cisgender, straight, rich, white Protestant men, the ones who in Republican values really matter. Once again, we have the murderously incompetent Republican leadership in America misinforming the public and having it handled by the severely disturbed tyrant, Donald Trump, and his allegedly closet case, Vice President Mike Pence, who redirected funds in his native Indiana from HIV prevention to pray away the gay programs. So he's lost all public trust and credibility about viruses or HIV or anything else. The United States under Republicans has some of the worst health records in the Western world by a wide variety of measures. Life expectancy, infant survival rate, all kinds of measures. Republican non-response to the AIDS crisis is as notorious as it is infuriating. Former President Ronald Reagan presided over 89,343 AIDS deaths and did nothing. For gay men who are now middle-aged, like me, and older, this fact is a stain on the history of our nation that is both traumatic and unforgivable. And yet here we are in the face of a new global crisis, and the United States Republican response has been drastically undermined by humor. Matt Gaetz wearing a gas mask on the vote and just making a mockery of it like some kind of a sophomore in middle school or something. Greed, misinformation, and, of course, unintelligible tweets on Twitter from Trump, as opposed to measured, scientifically informed public announcements that guide and lead and protect the American people. So while the coronavirus or COVID-19 affects more than just one particular group of people, it disproportionately affects and kills older people. But even this isn't compelling for the current Republican leadership, who just this week committed to cutting Medicare and Social Security and in the new federal budget if Trump is reelected this year, in this cavalier, just let the old people starve and die attitude. And as an activist, not only for gay men and LGBT people and people living with HIV/AIDS, but also for seniors and other people with disabilities, I take issue with that. That's undermining the safety net that protects America's elderly, like my parents or my grandparents or the loved ones who are older for any of us. And in typical Republican fashion, anything that gets in the way of corporate profits, even a little bit, like concern over COVID-19, is shunned as being the enemy of business, such as acknowledging climate change. So the number of COVID-19 deaths, that pales currently in comparison to the number of daily global car accidents, and yet we don't ban driving. But we don't yet know where COVID-19 is going as a pandemic. Just like we didn't know exactly how many deaths from AIDS would take place when it first became known in the U.S. in 1981. How much exactly should we be worried? Exactly what should we start doing, change what we do, or stop doing in our collective daily lives? Many people worldwide are asking these kinds of questions, and only time will tell. But I maintain, as a licensed mental health professional, an LCSW, licensed clinical social work, who has been a gay men's specialist psychotherapist and HIV/AIDS mental health expert for over 28 years now, and after living with HIV myself for 30 years this year, that the anxieties about COVID-19 are different for gay men than for the average person. Not because of any extra health risk exactly, but because we've seen it all before. Fool me once, Republicans, shame on you. Fool me twice, Republicans, and fuck off and die. Gay men like me who are old enough to have been adults at the time of the early years of the AIDS crisis, even if young adults, I was diagnosed at age 26 in 1990, We might have survived the height of the epidemic and learned to live with a chronic rage at Republican indifference, dismissal, and incompetence at their early non-response to the pandemic. But all of these feelings get reignited, triggered when we see it happening all over again, this time with a different mysterious virus that has inadequate testing, no cure, and all kinds of irrational pandemonium and hysteria, causing everything from large public event cancellations to runs on hand sanitizer to shortages of toilet paper shelves. And it's because people aren't being educated enough by our leadership, and sound, rational measures are not being announced and educated and talked about and validated by science. So for those older gay men who have seen Republican arrogance, indifference, and lack of response and greed and humor, their sick humor about it before, we have a warning. Good luck providing leadership in the crisis, and don't fuck it up. Because this time we're going to be much less forgiving of government inaction and indifference and incompetence to the public health that ends up killing our loved ones. And as Endora says to Darren in the 3rd episode of Bewitched, from now on, watch your step. Mother is watching you. Thanks for listening. Keep safe. Good luck. And we will get through this together, just like we've been doing for a long time.